Now let's talk about the female urogenital tract. So it consists of the external genitalia as well as the orifices. The orifices include the urethra and the vagina. So now let's talk about the vulva. Vulva is a collective term for the entire area of the female external genitalia. It includes the mons pubis, the labia majora, the labia minora, the clitoris, the vestibule, vestibular bulbs, and the greater vestibular glands, which are corresponding to the male vulvourethral glands. Talk about the vestibule. It is a specific space which is posterior to the glands, clitoris, and the labia minora, GCL. The vestibule has the openings of the urethra, vagina, and the ducts of greater and lesser vestibular glands. Here you can see the mons pubis, the ducts of greater vestibular glands, labia minus, and the labia majus. Now let's talk about the blood supply to the vulva. So blood supply is going to be from the branches of external and internal pudendal arteries on each side. Now let's talk about the lymphatic drainage of the vulva. So that is going to be from the medial group of the superficial inguinal lymph nodes. Nerve supply is the same as the scrotum. So interior part of the vulva is supplied from the ilioinguinal nerves and the genital branch of the genitofemoral nerves. And the posterior part is going to be supplied with PP, which is perineal nerves, and the posterior femoral cutaneous nerves, PFCN. Now let's talk about the clitoris. Clitoris is a female phallic organ that corresponds to the penis in males, and structure is similar to penis. So at the apex of the clitoris, we have the vestibule, which is anteriorly situated. Now let's talk about the root of the clitoris. So we are going to have a root and a body. So the root is going to be made up of I and C. So it is made up of two columns of erectile tissue. First of all, we have right and left corpora cavernosa, and then we have ischiocavernosus, which is going to surround each corpus cavernosum. These paired units are going to form the crura of the clitoris. Now let's talk about the body of the clitoris. So for the root, you have to remember IC, and for the body, just remember CPT. It has corpus cavernosa, which are going to be covered with dense connective tissue. So corpus cavernosa is paired, and it is below the pubic symphysis, and it is adjoined side by side. So corpus cavernosum plus the dense connective tissue is going to form the body of the clitoris. Now let's talk about the glans of the clitoris. So a glans is a small mass of erectile tissue which caps the body of the clitoris like this. So this is the clitoris, this is the glans. So the glans is connected to the vestibular bulbs, GV, by very small bands of erectile tissue. Prepuce is partly going to cover the glans. So glans is covered with the prepuce. So for example, we can say that prepuce is like the feather on this hat. So clitoris is covered by glans is covered by prepuce. The epithelium of the glans has numerous sensory endings, and it is the most sensitive part of the clitoris. Glans is the most sensitive part of the clitoris. So this person is very sensitive about his hat. Now let's talk about the lymphatic drainage of the clitoris. So it is going to be drained by internal iliac lymph nodes or the deep inguinal lymph nodes. Nerve supply is going to be from the pudendal nerve branches. We have the sensory fibers from the clitoris, and they're going to supply motor supply to the skeleton muscles, ischiocavernosus. So now let's talk about the vestibular bulbs. Each vestibule is surrounded by a bulb, and bulbospongiosus is going to cover each bulb, and the bulb is going to attach to the inferior surface of the perineal membrane as well. There are paired erectile bodies on each side of the vestibule deep to the labia minora. Anteriorly, the bulb is going to connect with the glans of the clitoris. So anteriorly, bulbs are going to connect with each other as well, and they're also going to connect with the glans, as in A, B, G, I, P. Bulbs are going to attach to inferior surface of perineal membrane. Bulbs are around the bulbospongiosus. So males have one bulb and females have two bulbs. Now let's talk about the greater vestibular glands, which are a pair of small mucus-secreting glands. And just remember two things for the greater vestibular glands, which are PBV and HL-. And PBV is going to be under the cover of the posterior parts of the bulb of the vestibule. So greater vestibular glands are going to lie under the cover of posterior parts of the bulb of vestibule. And each greater vestibular gland is going to drain into vestibule by a small duct which opens into the groove between hymen and the labia minus. These glands are going to secrete lubricating mucus during sex, and greater vestibular glands are homologous to male vulvourethral gland. Now let's talk about the superficial perineal pouch. So superficial perineal pouch is present between superficial perineal fascia and perineal membrane fascia. So the presence of greater vestibular glands in the superficial perineal pouch is homologous to the presence of vulvourethral glands in the deep perineal pouch. So the contents of the superficial perineal pouch, we are going to have bulbs, crura, muscles, nerves, and greater vestibular glands. So when we talk about the bulbs, we are also going to remember the bulbospongiosus muscle. When we talk about the muscles, just remember superficial transverse perineal muscles. And for the crura, just remember ischiocavernosus as well. And for the nerves, we have the perineal nerves and vessels for the superficial perineal pouch. So for the muscles, just remember BIS, the bulbospongiosus, ischial cavernosus, and superficial transverse perineal muscles. When we talk about bulbospongiosus muscle, please remember that bulbospongiosus muscle is going to surround each vestibular bulb and vaginal orifice. So it is going to connect to the corpora cavernosa as well. And the function is going to reduce the size of the orifice of vagina, and it is going to compress the deep dorsal vein of clitoris and assist in the erection of the clitoris. I is for the ischial cavernosus on each side of the crus of the clitoris. So I is on each side of I and C, and B is on either side of orifice. So ischial cavernosus is on each side of the crus of the clitoris, and the contractions are going to cause the erection of the clitoris. Now let's talk about the nerve supply of the superficial perineal pouch. So the perineal branch of the pudendal nerve on each side will terminate in the superficial perineal pouch and will supply the muscles and the skin. Now let's talk about the perineal body, which is larger than males. It is clinically important. It is a wedge-shaped mass of fibrous tissue which is present between the lower part of vagina and the anal canal. The point of attachment of many of the perineal muscles, as in males, include the levator ani. Levator ani is going to support the posterior wall of the vagina. Now let's talk about the deep perineal space, which is present between the deep perineal membrane and the inferior fascia of the pelvic diaphragm. In females, it is going to contain urethra, external urethral sphincter, part of vaginal branches of the internal pudendal vessels, and their nerves. So we have a urethra, a sphincter, vagina part, and the branches of internal pudendal vessels and nerves. Now let's talk about the external urethral sphincter. In females, the superior, more vertical part is going to extend as far as the neck of the bladder, and inferiorly, there is going to be a sphincter-like unit which is encircling the urethra, which is sphincter urethri muscle. Additional parts extend from the sphincter and they relate to the urethra or the vagina. These are the compressor urethri and the ureterovaginal muscle. No organized internal urethral sphincters are in females, and deep transverse perineal muscles are also absent in females. Smooth muscle mass instead is going to run along the posterior margin of the perineal membrane and attach to the perineal body. Now let's talk about the female urethra. So female urethra is about 1.5 inches long, and it extends from the neck of the bladder to the vestibule from N to V. And it is going to open 1 inch behind the clitoris, and it is present in front of the vagina. It is going to pass through the HSP, which is the genital hiatus, the sphincter urethra, and the perineal membrane. It is going to lie in front of vagina and forms a palpable bulge on the anterior vaginal wall. Small openings of the ducts of the lesser vestibular glands are at side of the meatus. Urethra can be dilated relatively easily, and the lesser vestibular glands are going to correspond to the prostate in the males, known as the paraurethral glands. There are present lesser vestibular glands are on each side of the vestibule. They open into the vestibule by small ducts on each side of the external urethral orifice. Now let's talk about the vagina. So female genital canal is the vagina. It is the excretory duct for the menstrual flow from the uterus. It extends upwards and backwards between the vulva and the uterus. It is 3 inches long. The cervix of the uterus is going to pierce the upper anterior wall. The vaginal orifice in a virgin is going to consist of a thin mucous membrane, which is called hymen, which is perforated in the center. Now let's talk about the upper half of the vagina, which is above the pelvic floor, and lower half of the vagina is within the perineum. Upper half of the vagina, which is above the pelvic floor, is within the true pelvis. It is present between the bladder anteriorly and the rectum posteriorly. Now let's talk about the lower half, which is within the perineum, which is between the urethra anteriorly and the anal canal posteriorly. This is very important, which is the structures that provide support to the vagina. So we have upper 1/3, middle 1/3, and lower 1/3. For upper 1/3, just remember L, T, P, S. L is for the levator ani, T is for the transverse cervical, P is for the pubocervical, and S is for the sacrocervical muscles. Let's talk about the middle 1/3. Middle 1/3 is of the vagina is supported by the perineal membrane. Lower 1/3 is supported by the perineal body. Now let's talk about the blood supply to the vagina, which is from the vaginal artery, which is from the internal iliac artery, and vaginal branch of the uterine artery as well. Vaginal veins are going to enter the internal iliac veins. The lymphatic drainage is also for the upper 1/3, middle 1/3, and lower 1/3. The upper 1/3 is external and internal iliac lymph nodes, middle 1/3 only the internal iliac lymph nodes, and lower 1/3 is from the superficial inguinal lymph nodes. Now let's talk about the nerve supply to the vagina, which is inferior hypogastric plexus. Now let's talk about the erection of the clitoris. Sexual excitement produces engorgement of the erectile tissue within the clitoris in exactly the same manner as in males. Now let's talk about female orgasm. As the sexual excitement builds, the vaginal walls are going to become moist because of transudation of fluid through the congested mucous membrane. In addition, greater vestibular glands at the vaginal orifice will secrete lubricating mucus. So the upper part of the vagina, which resides in the pelvic cavity, has a visceral afferent innervation through the hypogastric plexus, and it is only sensitive to stretch. However, the region of the orifice, the labia minora, and the clitoris, so COM, clitoris orifice and minora, they have a somatic afferent nerve supply through the ilioinguinal nerves and the dorsal nerves of the clitoris IND, which are extremely sensitive to touch. Appropriate sexual stimulation of these sensitive areas, reinforced by afferent nerve impulses from the breasts and other regions, results in climax of pleasurable sensory impulses reaching the central nervous system. Impulses will pass down the spinal cord to the sympathetic outflow, T1 to L2. Nervous impulses that pass to the genital organs are thought to leave the spinal cord at the L1 and L2 in preganglionic sympathetic fibers, and many of these will synapse with the postganglionic neurons in the L1 and L2 ganglia. Others will synapse in the ganglia in the lower lumbar or pelvic parts of the sympathetic trunks. The postganglionic fibers will distribute to the smooth muscles of the vaginal wall, which rhythmically contracts. In addition, nervous impulses will travel in pudendal nerves S2, S3, S4, which will also reach the bulbous spongiosas and ischiocavernous muscles, which undergo rhythmic contraction as well.